Welcome back to Doc Talk Live, a live call-in health show brought to you by V-Care Home Health, leader in providing home healthcare services throughout the entire DFW Metroplex. Our second sponsor is Dallas Renal Group, a physician group that Dr. Chowdhury and I belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or the Dallas Renal Group Facebook page. This is Dr. Vic Prakash, and I'm co-hosting today's show with Dr. Kashif Chowdhury. We're live in studio with Dr. Abdul Hayee and Dr. Irfan Ali discussing pain management. We got a lot of phone calls, so keep trying to call in. The number to the studio is 972-235-5555. Let's start off with the caller. Hey, you're on the air. What's your question? Hello? All right, let's start off with the question that we got from a caller during the break. He was concerned because in 2012 he was told he had some disc degeneration and nerve impingement, and after a few months of physical therapy that improved. Unfortunately, a few years later that pain started to recur. He did more physical therapy and it improved again, but his question is, what's the long-term fix for this problem? Dr. Hayee?
So that's a great question. You know, when we're in training, we're only in training for a year to 3 years, or whatever our residency and fellowship is, and we get to see snapshots of patients' lives. But now that I've been practicing for 10 years, I've seen patients like this who have flare-ups in their pain, and they're able to get better with just therapy or simple injections, and they continue to live their life. That's really the key thing. If they're able to do the conservative measures and continue to live their life, the physical therapy will help maintain a protective environment for their muscle spine health so they don't injure themselves further. The key is for them to do the physical therapy and stay active and live that healthy lifestyle. If they're finding that as their symptoms return, their pain is getting worse, then they would go on to the next step in the algorithm where we can treat them with a little bit more interventional approach.
Let's take another live call. Go ahead, you're live on the show. Dr. Ali, what's your thoughts?
Yeah, so this is seemed like this happened about 2 weeks ago. So this still falls in the category of like acute pain. Anything anywhere between 6 weeks up to maybe 6 months could be considered acute pain. Very common scenario which happens. Most likely these things happen: soft tissue injury, muscle strain, ligamentous injury, and with the non-steroidal anti-inflammatory drugs, conservative measures, these things get better. But obviously, if this is something which continues to be a problem, then definitely she should seek appointment with her PCP or interventional pain specialist to further, investigate that.
We had another caller during the break who was asking about certain herbs or supplements. He specifically brought up turmeric as a potent anti-inflammatory agent, and he also was questioning whether milk can cause more inflammation in the body, and is that related to pain? Can you comment, Dr. Haas?
Yeah, so turmeric, several of my patients, especially those of non-Asian descent, are utilizing turmeric more and more. And although I haven't seen specific studies relating to the efficacy of or the effectiveness of turmeric, if it works for you, definitely use it. But we do know there are some key vitamins that you should be supplementing if you have pain and nerve issues. Chief of them is going to be magnesium. Your daily vitamins that contain magnesium, folate, B12, those are key in muscle strength and nerve health. As far as turmeric goes, ginger, ginkgo, those things, certainly you're welcome to augment them. We won't discourage any patients to do so.
All right, let's take another live call. Go ahead with your question. You're live on the show.
Hello, you're on the show? Yeah, go ahead.
this is physical therapy versus etodolac?
So, yeah, so I think it's a common problem, frozen shoulder, or they call it like impingement in the shoulder. So what happens, the more you go on without therapy, the difficult the problem is going to get. The better it is. Etodolac is obviously one modality. You're using anti-inflammatory medication. The physical therapy is definitely the key. At this point, the more you start moving it, that's a better way to resolve it. Sometimes there could be some injections which can be done to help expedite that process, but I would definitely encourage him to start getting physical therapy as soon as possible.
Let's take another live call. Go ahead with your question. You're live on the show. Thank you. So I think there was some interruption in the question, but basically what they're trying to ask is if it is related to soft mattress and the pain on one side while laying down and it's not radiating to the side.
This is Dr. Heiss. Just to answer that question, when we talk to patients about what mattress they prefer or what would be best for their spine, I always tell them you want the mattress which is most comfortable to you, but for the spine, you want your spine to be neutral, meaning it's not flexed forward or flexed back. So when they lay on it, it's completely neutral or straight. And this is where you ask your spouse to give a hand and see if your spine is actually laying correctly on that and not flexed too much forward or extended backwards. That way you can have the rest that you need to basically have a full night's sleep. The second part of that is to remain as active as possible, have a daily stretching routine so that if you do sleep improperly, when you wake up in the morning, you have a routine to help yourself get limber.
Let's take another live call. Go ahead with your question. You're live on the show. Sounds more like an orthopedics question, but Dr. Ali, do you want to give your response?
Yeah, so it seems like, it involves a young guy, most likely the way he's describing. The most common thing which happens during any of these activities or athletics, the things that people injure is either the ligaments or the meniscus, the smaller mechanism which are in the knee. And once you injure them bad enough, sometimes it does happen that the knee becomes unstable. And at that point, I think the best course of action would be to prevent further injury, get therapy, and maybe seek opinion from an orthopedic surgeon, because if it's a young guy, you definitely don't want it to keep happening and have an unstable knee. So this could happen from an injury.
Very understandable. So, Dr. Hayee, what are the side effects of some of the commonly used pain medications, especially NSAIDs?
Yeah, so we've talked about NSAIDs as the first line of treatment. We know that there are certain side effects from them, mainly the GI or stomach side effects. It can lead to erosion of the stomach lining that would lead to ulcers. And then certainly the effects on the kidney can cause kidney damage, renal insufficiency as we call it, seen in about up to 20% of users of NSAIDs. So because of that, we would like to limit its use. Stronger pain medicines such as opiates or narcotics as they're referred to, there's several of them. There's certain known side effects such as constipation, itching, nausea, and then there's the behavioral side effects where people can get dependent on them and then start misusing them. And so for this reason, it's really what our specialty is here for. We try to identify the cause of pain and utilize medications to allow you to rehabilitate, utilize injections to allow you to rehabilitate and heal, and then get you off of those medicines as quick as possible.
Dr. Ali, another common problem are headaches. What are the different types of headaches and how do you typically approach them?
Yeah, that's a very common problem after backache. So there could be multiple reasons from headaches. There could be simple headaches from muscle spasm, tension headaches. There could be more like cluster headaches. More could be related sometimes to arthritis in the neck, or like if the neck joints have arthritis, that can cause headaches as well. Then there are small nerves on the head, like occipital nerves, things like that. Those nerves can get entrapped. They can cause headaches as well. So there is a whole variety of things which can cause headache, and that's why. If that's something, and then migraine obviously is another thing. There is a different approach to deal with all different kind of headaches. There are different kind of interventions that can be done to deal with all different kind of headaches. And if that's something which has been going on for a while, that's when you should seek opinion from an expert to see what kind of headaches you are and base your decision and treatment plan based on that.
Let's take another live call. Go ahead with your question. You're live on the show. Dr. Hayee.
So the first thing would be to identify where this nerve pain is arising from. It could be arising from the spine. It can also be arising from the waist area. And so there are several nerve syndromes that can mimic this type of pain in the thigh radiating to the knee. We'd have to look at your pain pattern, look at your x-rays, do an examination, and then we can identify the source of your pain. From that, tailor-made injections that can help alleviate that nerve pain, or even tailor the medications that would be best for it.
So, Dr. Hayee, does insurance pay for pain management?
Certainly, pain management as a specialty has been around for over 30 years, and there's most of the procedures that we do are covered by insurance. In fact, most of the procedures that we do are done in our office setting. There's a lot of practices that do them at a surgery center, at a hospital. We do most of ours in our office. It's more convenient to our patients and for us, and it's much more affordable for them.
All right, let's take a live call. Go ahead with your question. Hello, go ahead with your question. You're live on the show. All right, so it's chest pain and rheumatoid arthritis.
Yeah, rheumatoid arthritis is like a systemic disease. It's not based on like one joint or like osteoarthritis that you could have just arthritis of the knee or the hip. It's more like a systemic disease. So there are patterns, sometimes if the rheumatoid arthritis involves the costovertebral joint, like the joints in the chest cavity where the ribs combine with the chest bone, that can cause pain. And sometimes the rheumatoid arthritis does cause like fibromyalgia like symptoms when you have like generalized body aches and pain. So this could be coming from rheumatoid arthritis as well, some possibility.
Okay. Let's take another live call. Go ahead with your question. You're live on the show. Treatment for plantar fasciitis.
So this is Dr. Hayee. Plantar fasciitis can be a very debilitating injury. The key for this is to really stay on top of it by doing the therapy and stretches that were prescribed to you. We manage patients with this by doing injections of either platelet-rich plasma. Some patients are actually doing some regenerative therapy for it. But if you let it go and do nothing for it, it'll oftentimes come back. You really have to change the behavior and maintain the good actions, the good stretching to keep it from coming back.
So we're approaching the end of our show. Please don't forget to check our website, doctalklife.com, and also our Facebook page, and subscribe to the YouTube channel. Dr. Hayee, would you like to make any last-minute comments about your practice or the things?
Sure. Just wanted to thank all the listeners for listening to us. We're located in Flower Mound, South Lake, Dallas. We'll be happy to take care of you in our office.
All right. Thank you very much. Stay safe. Dallas.